Hi, my name is Susan McLennan. At the Directions, pre-retirement planning seminars held around the state for executive branch state employees, many of you told us it would be helpful to have a video from the seminar to review. We understand there is a lot of information to consider when planning your retirement, so we created this series of short videos to help guide you. Welcome to the video guide, Planning Your Successful Retirement. Like the seminars, these videos can only provide highlights. More comprehensive details can be accessed on the WORWebServices website at worklife.ny.gov and by talking with your agency health benefits administrator. You will also want to thoroughly review Chapter 10 of the online version of the Self-Help Guide to Pre-Retirement Planning, available on the same website. Medicare Part 2, Coordinating Your NYSHIP Benefits, is the name of this video. Kevin Kreis, a Department of Civil Service Employee Benefits Division representative, will provide you with important information regarding how the New York State Health Insurance Program, NYSHIP, and Medicare work together. He will also discuss the Medicare Advantage Plans and prescription coverage options. Please note, there is another health insurance video which provides more details on NYSHIP and Medicare. And for more general information on Medicare, particularly if you are not eligible for NYSHIP, please view the Social Security video on Medicare. Now, here is Kevin.
It is important to keep in mind that if you are enrolled in the Empire Plan and you or your dependent is Medicare primary, the claim is paid first by Medicare. The Empire Plan pays as a secondary carrier. Most claims submitted to Medicare first are automatically sent to the Empire Plan for consideration as the secondary carrier, since most Empire Plan enrollees and dependents are automatically enrolled in the Medicare crossover program with United Healthcare. Medicare Advantage plans are health plan options like an HMO or a PPO approved by Medicare and offered by private companies. Medicare Advantage plans provide all of your Medicare Part A and B coverage. Medicare Advantage plans usually include prescription drug or Part D coverage. Medicare Advantage plans may provide extra coverage such as dental, vision, or wellness programs. With a Medicare Advantage plan, you no longer have traditional Medicare coverage. You must follow the Medicare Advantage plan rules. Essentially, your Medicare coverage and your Medicare Advantage HMO coverage becomes one coverage, and you have no coverage outside of the HMO benefit. Emergency coverage and, in some cases, a travel benefit may be included under the contract. It is very important that you understand what benefits are available to you both within and outside of the plan's service area. Traditional NYSHIP HMOs coordinate benefits with Medicare. If you or your dependent is Medicare primary, the claim is paid first by Medicare and the HMO pays as a secondary carrier. Most NYSHIP HMOs are in fact Medicare Advantage plans and contract with Medicare to provide benefits to Medicare beneficiaries. Again, if you are enrolled in a NYSHIP Medicare Advantage plan, the HMO is responsible for providing all of the benefits that would be provided under traditional Medicare coverage. The HMO provides both your Medicare and NYSHIP coverage, and you have no benefits outside of the benefits provided by that HMO, with the exception of emergency care and, in some cases, a travel benefit. Medicare Part D provides prescription drug coverage. Plans are offered by private companies that work with Medicare. Benefits and costs vary. NYSHIP coverage is creditable coverage. This is important to you. It allows you to enroll in a Medicare Part D plan at a future date without penalty for late enrollment, as long as you enroll in the Medicare Part D prescription drug plan within 63 days of loss of NYSHIP drug coverage. We send out a creditable coverage letter annually to provide you with proof that your NYSHIP coverage is creditable coverage. NYSHIP will continue to provide prescription drug benefits for Empire Plan enrollees and NYSHIP HMO enrollees. Prescription coverage continues even when Medicare becomes the primary coverage. Enrollees in traditional HMOs and the Empire Plan do not have a Medicare Part D plan with their NYSHIP coverage. NYSHIP Medicare Advantage HMOs provide prescription drug coverage through a Medicare Part D plan. NYSHIP Medicare Advantage HMO enrollees and/or dependents will lose their NYSHIP hospital, medical, and prescription drug coverage if they enroll in an outside Medicare plan. Since you are entitled to be enrolled in only one Medicare option, if you subsequently enroll in a Medicare plan outside of NYSHIP, you will automatically be disenrolled from your NYSHIP Medicare Advantage HMO coverage by the Centers for Medicare and Medicaid Services. If you enroll in a freestanding Medicare Part D drug plan, your hospital and medical coverage under Medicare will revert back to traditional Part A and B coverage. However, you will not have secondary coverage through NYSHIP unless you change your NYSHIP option through the Employee Benefits Division. For Empire Plan or traditional HMO enrollees and their dependents, enrollment in a non-NYSHIP Medicare Advantage plan will take the place of your traditional Medicare and will cause a reduction in benefits. Enrollment in a Medicare Part D plan outside NYSHIP will require you to use that as your primary prescription drug coverage. Empire Plan enrollees can send in prescription drug charges for secondary consideration by submitting the prescription drug receipts with a Medicare Part D claim form to the prescription drug carrier. Traditional NYSHIP HMO enrollees should check with their HMO about coordination of prescription drug benefits. If you are thinking about enrolling in a non-NYSHIP Medicare Advantage or prescription drug plan, be sure that you understand how your NYSHIP benefits will be affected, and if you have questions, please contact the Employee Benefits Division before you enroll. If you or your dependent is eligible for Medicare primary coverage, we suggest that you enroll when first eligible for Parts A and B. Enroll in a Medicare Advantage plan only through NYSHIP. If you choose to enroll in a Medicare Part D plan outside NYSHIP, be sure you understand how your coverage will work. Call the Employee Benefits Division before you become eligible if you have any questions.
Should I buy additional coverage to supplement my NYSHIP coverage?
We get this question all the time, and it is good to think about what coverages you may or may not need. However, the decision to buy additional coverage to supplement your NYSHIP coverage is a personal decision that only you can make. While making your decision, please keep in mind that the coverage you are considering purchasing may have an impact on the coverage that you currently have through NYSHIP. Please contact the Employee Benefits Division if you have questions or concerns about purchasing additional coverage. Thank you.
That brings us to the end of this video segment. For more details about the New York State Health Insurance Program, we invite you to view the other health insurance videos and to visit the New York State Department of Civil Service website at cs.state.ny.us. Then go to the Retirees tab on the homepage. Talk with your agency health benefits administrator or call to speak with a New York State Civil Service Employee Benefits Division representative. To reach the Employee Benefits Division, call 518-457-5754 if you are in the Albany area, or call 1-800-833-4344. Remember, once you retire, the Employee Benefits Division will serve as your health benefits administrator. Thank you for your service to New York State and have a wonderful retirement.